Sitting inside an ambulance, and normally if I'm sitting inside an ambulance, I'm probably in Wanakee, but in this case, I'm in Fitchrona's ambulance, Fitchrona 45,
Yes, the
which is
Verona ambulance.
which is the Verona ambulance, and of course we've got Deputy Chief Jeff. How we doing? Doslick. I'm really bad. I don't usually say the last name. I should.
Deputy Chief Jeff is fine.
Yeah, you know.
And it's not snowing or it's not raining today, so we're good.
It's sunny out. It's nice. It's spring now, so you know, maybe we're out of the fall season. Knock on wood.
Right. Great morning.
But either way, what we're doing today is we're going to talk a little bit about what's inside the ambulance, certainly. So if you ever have to pay a visit inside here, maybe you won't be as intimidated,
Right.
certainly. But it's not all scary, I can tell you that.
It's not.
So Jeff, start us off with you got the monitor here, and
Yep.
that's probably the first thing that catches everybody's eye when you do get into an ambulance.
Sure. So we have the Zoll X-Series monitor, so that's what we use throughout pretty much a lot of the ALS services in Dane County use the Zoll. It's compact, it's fairly light to carry. The nice thing about this monitor is that we can put a blood pressure cuff on. We can do cardiac monitoring with it. We can do a 12 lead EKG to look at the heart. We can do a pulse ox. We can do end-tidal CO2, so we can check somebody's respiratory status or cardiac status with that. And it's all kind of right in this unit here. It allows us to defibrillate, obviously, if we need to defibrillate somebody. And then we can also, from here, we can send the 12 lead EKG directly to the hospital. So our goal is in the first 3 to 5 minutes of arriving on scene of a chest pain cardiac patient that we get a 12 lead done. We get 12 lead done, we get it sent to the hospital, and we can alert the hospital that if the patient is having what we call a STEMI, a heart attack, ST elevation, MI, that they can alert the cath lab, they can get things rolling at the hospital for us. And that way when we roll through the door, instead of stopping in the emergency room, sometimes, a lot of times we go directly to the cath lab, and it saves time and it saves muscle, and we call it the time of the 12 lead, door arrival time to reperfusion time. And we know getting there quickly and doing that saves lives, and that's our main goal. So the monitor here is very versatile. It's compact. It's allows us, not that we drop it, but if something were to happen to it, it's very sturdy, and we have good cases on there, and it's a workhorse for sure.
Yeah, I think the take home definitely is that if you're put on a monitor, it doesn't mean necessarily that something's going wrong. It's nice that you're able to take those vitals electronically, so if there's something else that needs to be done,
Correct.
that can continue to go on its own, and you can keep up on the vitals and whatnot. So
That's exactly what we use.
But compact is good in EMS world, I have to say.
That's
So,
true.
And then a staple of EMS is bringing in some type of bag, if you will, and
Sure.
the Merit bag is kind of the EMS classic bag, if you will, for a jump bag coming into your residence. So
Right. So this one's a little bit heavier than that's for sure. And we have everything in here that we're going to need to initially take care of the patient. And even a lot of times the paramedics will work directly out of here when they get in the ambulance, just throw it on the bench or put it on the floor and work out of the bag as well. But inside, if I can get it opened up here. Inside the bag, we have everything we need to do to start an IV if we need to start an IV. All of our frontline, first-line medications are in here, so if we're going to work a cardiac arrest, the epinephrine, all that stuff that we can do in here. One of the things that we've actually increased our stock on a little bit is Narcan because of all of the narcotic overdoses that we've seen in the district. So we have that in there as well. Our medications, frontline chest pain medications, all of our respiratory meds are in here as well. So in essence, we take this in, we can take the monitor in, we have an airway bag down here. Those are the three staples that we take into the house with us, and we're able to pretty much run the emergency with that right there.
yeah, it's kind of like the portable ambulance, if you will, right into the house to take care of things. So
Correct.
There's certainly outside compartments that have different tools for specific, but this is kind of the main line for the paramedics to go in and do their job.
Yep, definitely, for sure.
Makes it a little bit easier, certainly. All right, so going back inside the ambulance, just in general, you'll see a lot of compartments in here, and they all serve a purpose. So just in general, what are common things that are inside here at the paramedics' reach?
Yep, so most of the stuff in here I would guess most of the ambulances, even the basic life support ambulances, would have in their at their disposal as well. So we have blankets and pillows and stuff that are in here, some cleaning supplies when we're done. Up in this cabinet up here, we just have extra nasal cannulas, airway stuff. So if that paramedic is really busy and maybe the bag's on the floor or it's on the other side of the ambulance and they need to do something, they can just open up the cabinet and it's all right there. Bag valve masks, things like that. And then back on the back of the ambulance is all of our bandages, 4x4s, trauma dressings, things like that that we do use, probably not as much as we use some of the other stuff, so it's there. And then here's kind of like a quick access, so IV, nitro, blood glucose monitors all sitting over here. So it's kind of at the reach. The goal for us is to be as safe as we can. So we strap in, supposed to strap in. And then so we can just sit here and we can do our stuff as opposed to jumping around and moving around. And even though we do have to do that occasionally, we try to stay as still as we can back here.
Yeah, I was going to say there's two follow-ups here that, safety is definitely a huge factor when even putting an ambulance together. So talk about some of the safety factors in here, and then we'll go back to quickly go back to what's inside here.
Sure. So I think one of the biggest things here is the net here. A lot of times, and I know the one instance where I was involved in an accident in Chicago is the provider slid down the bench seat when we had to hit the brakes quickly, and this wasn't here, so the provider wound up in the door well right here. Mm-hmm. So seatbelts, obviously, for sure. We have a car seat that we can either strap to the cot, or for bigger children, the car seat, will open up back here. Harnesses for the paramedics to sit. The stretchers that we have the Stryker stretcher, which is a power cot for us. So you'll see us pull it out, and then we just push a button, the wheels go up and down. And for that, especially for patients in the house, as opposed to lifting the patient on the stretcher, which is what I did when I first started.
That's why you're so buff.
Right,
Right. You got it.
We can just press a button and the cot comes up. Starting with the new ambulance that will be here in June or July of this year for us, we'll have the power cot. So in essence, we'll be able to raise the cot with a button, push it, lock it into the ambulance, push the button, the wheels come up, and we can just push it in. So back injuries are the number one cause of providers going out of the business or being on disability. So we try to minimize that as much as we can.
Awesome. And going back to the internally here, I think something I didn't know until I became a part of an EMS service is you have to have this stuff in here. That's also part of the state mandate. So there are reasonings for why you have to have so many things in an ambulance.
Exactly.
It's part of a state checkout. So I think that's something that people should know as well. So.
Right. So we kind of call ourselves the emergency room on wheels, and really, if we're doing any sort of cardiac arrest, all of that stuff that would be done in the emergency room for those types of patients can be done right back here. Obviously, the big procedures, we still need to go to the hospital, but we have the same drugs that they have in the emergency room, and that's why we carry all the stuff that we do. Sometimes people think it might be a little bit of an overload, and it's really not, because I can guarantee you on a busy day, they're going through this bag a couple of times and restocking stuff and moving on to the next call.
Absolutely. Well, certainly if you ever want to set up a tour, I think people can set up and come and visit you guys anytime.
Yep, absolutely. Just get a hold of me, Jeff D. at FitchronaEMS.com. Call down here to the station and we'll set up a tour. People do ask about ride-alongs. We do allow ride-alongs. There's a couple of requirements. We have to make sure that you have all of your immunizations, sign a waiver, and you can contact either Patrick or myself to set that up as well.
Awesome. Yeah, and now, of course, you guys are out at public events too, so make sure you stop in, say hi to the paramedics, take a look at the ambulance, the best way to see everything that's going on here.
Yep.
All right, Jeff, as always, appreciate it, and we'll see you next month.
Sounds good. Thank you.